If you fall ill in the UK, you can go to the National Health Service and you're guaranteed to be cared for free. But the NHS hasn't always been there. It was only founded in 1948, and I assumed that before then, anyone who fell ill would either have had to fork out their life savings to pay for a doctor or lie in bed and hope to get better. Of course, history's more complex than that. Free medical care has been alive and well in Britain for over 1,000 years, even if it was provided for hundreds of those years by men and women with absolutely no medical training. The story of healthcare before the NHS begins in an unexpected place, the monasteries of medieval Britain. As well as conditions that survive today, Europe in the 14th and 15th centuries was beset by a whole range of diseases since eliminated by vaccination. Leprosy, diphtheria, bubonic plague, you name it, they had it. And because most ordinary people couldn't pay a doctor, it was typically monks from the monasteries that cared for them. Monastic hospitals existed as early as the 6th century, but many were wiped out by Viking marauders. In the years following the Norman conquest, over 700 monastic hospitals were founded in England. These were open to anyone who couldn't afford a doctor. Medieval monastic hospitals were a combination of what we'd recognise as care homes, sanatoriums and almshouses. As in hospitals today, there was a big emphasis on diet and cleanliness. Invalids were fed more meat than was usual and bathed regularly. Healthy people hardly ever washed. Bloodletting was common, and monasteries grew their own herb gardens to provide medicines. The monks had at best rudimentary medical knowledge. Prayer and application to the saints were thought to give the best chance of recovery. Salvation of the soul was considered more important than cure of the body. When the chances of a patient's survival seemed desperate, the monks provided the service which they considered most vital of all, preparing the invalid's soul for death. The chances of recovering from illness inside a monastic hospital were no better than inside your own home. Nevertheless, the monks offered a basic service for free to a wide range of people. This system operated for hundreds of years, but it came under threat in the early 16th century when Henry VIII decided he wanted to divorce Catherine of Aragon, and Pope Clement VII wouldn't let him. In response to the Pope's intransigence, King Henry broke with the Catholic Church and appointed himself head of the Church of England. He dissolved the English Catholic monasteries and transferred their assets to himself. As a result, the hospitals maintained by the monasteries were closed. The monks were pensioned off, exiled, imprisoned, or executed. The old, the vulnerable, and the sick were left to roam the streets. The problem became so extreme that the Lord Mayor of London implored the king to intervene. Henry made special royal endowments to keep a handful of the London monastic hospitals running and carry on the work of the monks. These crown-funded royal hospitals included St Bart's and St Thomas's, both of which are open today as part of the National Health Service. This was the first time in England that the state, in this case the king, had given money to hospitals to provide free care. But this was all in London. A few local authorities stepped in elsewhere, but you'd have been lucky to live near one of the few hospitals outside the capital. London's wealth and global status surged during the 17th century, and the population of the city trebled. In the 1680s, between 40 and 50,000 Protestant refugees arrived from France. As the city's slums started to expand, disease became rife. By the turn of the 18th century, the royal hospitals couldn't cope with the numbers coming to their doors. Some began charging admission fees, which meant that the poorest couldn't access them anymore. London's status as an international trading centre was growing, and a new class of wealthy business people started to emerge. Some from this cash-rich bourgeoisie decided to help those less fortunate than themselves. During the first half of the 18th century, several new hospitals were founded across Britain, funded by wealthy philanthropists. Their aims weren't purely altruistic. It was in the interests of capitalists to keep their workers healthy. Also, hospitals helped to halt the spread of diseases, which didn't respect the niceties of class divisions. These new hospitals were known as voluntary hospitals. Many of today's most famous hospitals started out this way, including Westminster Hospital, which was founded in 1720 by the banker Henry Hoare. When it opened its doors, Westminster Hospital declared itself an infirmary, where the poor sick who are admitted into it are attended by physicians, surgeons, apothecaries and nurses, supplied with food and physic. The voluntary hospitals were innovative places at the cutting edge of medical science and the earliest teaching hospitals. A lot of the great advances in medical care of the late 18th and early 19th centuries happened thanks to the voluntary hospitals, just as they happen now thanks to the NHS. Hospitals had come a long way from medieval spaces where the sick were given a bed, food and prayers. Surgical intervention was more common. The goal now was to cure the sick, not through devotion and hope, but scientific knowledge. But it wasn't easy to get into a voluntary hospital. Except for occasional emergency admissions, patients often needed the support of a petition or nomination by a governor or sponsor of the hospital. If you did manage to get a bed, you were one of the lucky ones. If you couldn't, you still had to fend for yourself. As Britain's booming population migrated to the cities throughout the 19th century, poverty worsened and the slums expanded to breaking point. By the 1830s, most parishes had set up at least one location where people who couldn't support themselves could be housed and employed. These workhouses were funded by a tax on the middle class called the poor rates. Workhouses were actually designed to be unpleasant places in order to ward people off. Inmates wore prisoner-style uniforms and were segregated. Parents could even be separated from their children. And as late as 1918, anyone who received poor relief was disqualified from voting. Almost all workhouses had a small sick ward to care for poor inmates, but medical provision was just awful and death rates were high. Campaigners fought for better conditions in workhouses and better medical care in the workhouse wards. Florence Nightingale and Edwin Chadwick began a 14-year campaign in 1858 to draw attention to the soaring death rates among inmates. In July 1865, the Lancet journal published a set of damning articles exposing the overcrowded, unsanitary London workhouses, denouncing the whole system as a disgrace to our civilization. The combined pressure of the Lancet and Florence Nightingale led to the Metropolitan Poor Act. The Metropolitan Poor Act was passed in 1867. It required London workhouses to locate their hospital facilities on separate sites from the workhouses themselves. The goal was to distance the practice of medical care from the terrible conditions of the workhouse. The new Act was one of the most important milestones on the way to the NHS. It established the Metropolitan Asylums Board, which, for the first time, took responsibility for the provision of care for the sick poor across London. As a result, workhouse infirmaries were opened up not just to workhouse inmates, but to poor people in London generally. Asylums were set up across London for the treatment of smallpox, fever, TB and venereal diseases. They became known as poor law hospitals. The poor rates taxes were now funding infirmaries and hospitals across the capital city. This marked the beginning of a government-funded medical service providing free treatment to those who couldn't afford it. While the royal hospitals had been funded by the Crown and the voluntary hospitals had been funded by charities, the workhouse infirmaries created by the Metropolitan Poor Act were funded by government-raised taxes. The foundations for the National Health Service were being laid. In 1905, the Liberal Party swept to power. Their agenda was dominated by policies designed to appeal to the swelling numbers of city-dwelling voters who still endured unsanitary conditions and inadequate healthcare. The Liberal governments of Henry Campbell Bannerman and Herbert Henry Asquith were the first to focus on hospital care up and down the country. In 1909, Chancellor David Lloyd George brought in what he called the People's Budget to wage implacable warfare against poverty and squalidness. The budget included tax increases on the wealthy and huge investment in what was effectively a welfare system. In 1911, the National Insurance Act was introduced, which meant that compulsory health insurance was provided for workers earning less than £160 per year, some 13 million workers at the time. This new national insurance was paid for by a combination of employers, the government, and the workers themselves. It meant that if workers ever fell sick, they'd be entitled to free medical treatment, but not their families, not their children, and certainly not the elderly or the unemployed. The First World War exposed the dire state of Britain's health. The Ministry of National Service Medical Boards inspected 2.5 million men from 1917 to 1918. Prime Minister Lloyd George was appalled by the findings. He said, "A war, like sickness, lays bare the weakness of a constitution. We have had a Ministry of National Service and carefully compiled statistics of the health of the people between the ages of 18 and 42. Now, that is the age of fitness, the age of strength. You have these grades 1, 2 and 3, and all I can tell you is the results of these examinations are startling, and I do not mind to use the word appalling. I hardly dare tell you the results. The number of grade 2 and grade 3 men throughout the country is prodigious. The survey found that only 36% of recruits of fighting age were grade 1, that is, attained the normal standard of health and strength. Grades 2 and 3 were considered unfit for military service. This panicked the military authorities. Lloyd George concluded, "I solemnly warn my countrymen that you cannot maintain an A1 empire with a C3 population." The government was seriously worried that widespread ill health was a source of national weakness and that this posed a direct threat to the British Empire. To add to the crisis of the nation's health, a global pandemic struck in 1918. Some 50 million died worldwide and 230,000 Britons were killed by the so-called Spanish flu. At the same time, about 8 million women over 30 had just been granted the vote. Many women were unemployed, and because most healthcare was available through employment-related insurance, they had no access. Health reform became a much more important issue to the voting public when women became a part of it. In response to these concerns, the government founded the Ministry of Health in 1919. Almost immediately, a report by Bertrand Dawson on schemes requisite for the systemised provision of medical and allied services advocated a more integrated healthcare system so that high-quality, modern care could be made widely available. But Dawson's recommendations were never put into practice because the Lloyd George administration fell to the Conservatives in the 1922 general election. There was clearly desire for an integrated national system, but without the political will, nothing more could be done. By 1922, the principles, practices and structures that define the modern-day NHS had come together over the course of a millennium to form a loosely coordinated but nevertheless national system of healthcare. But the foundation of the NHS proper was still a quarter of a century away, and without the greatest crisis Britain had yet faced, it might never have been formed at all. Don't miss our next video on the radical history of healthcare in the UK, here when it's published.